How has COVID-19, the pandemic, affected the war on drugs in Kentucky?
Well, COVID-19 has in fact impacted every part of our lives in this country and around the world. Certainly, problems with substance use disorder are exacerbated by COVID-19. The isolationism, loss of income, the loss of a recovery community, of being able to be with people who are have shared stories and shared situations, which is so important in recovery. And now you're stuck in your house, and it's really hard to have those kind of contacts again. So yes, it's definitely impacted. We've seen an uptick in overdose EMS runs. We've seen an uptick in overdose fatalities during this 4-month period. So yes, it's a problem, and we're going to continue to try to work to address it.
So that said, you offer a ray of hope. You feel like even though, the war on drugs is continuing, you feel like there is light at the end of the tunnel.
Well, I'm very blessed in this position, Barbara. I get to meet people whose lives have been to the gates of hell, who've been in prison, who've lost families, who've lost their loved ones, have lost the trust of anybody who ever loved them, and they come back and they've recovered. They've got treatment for their disease, and they're 3, 4, 5 years sober. In Kentucky, we have a statewide call center. It's 8338-KY-HELP. And if folks will call that number, either someone with a substance use disorder or a friend or family member, they're going to find some hope at the other end of that line. They're going to find a trained social worker that can help them locate the right treatment for them here in Kentucky. We're also very lucky in Kentucky to have a robust substance abuse benefit within Medicaid. During this COVID-19, we have suspended all prior authorizations, so someone can get treatment and get help almost immediately. A great many of our larger treatment centers have availability right now and have the ability to get people in today.
The drug of choice in the war on drugs, especially in the state of Kentucky, seems to be cyclical. 1 year it's a particular drug. What are we looking at right now? What is the substance that is causing the most concern in Kentucky?
Well, certainly fentanyl is driving our overdose deaths and fentanyl analogs. Fentanyl is so powerful. It's 10 times more powerful than heroin. And it's extremely dangerous. But the last 18 months or 2 years, cartels have flooded the United States with very cheap, very potent methamphetamine. Sometimes we see that even laced with fentanyl. So there again, another compelling issue, another compelling problem. I've talked to individuals with a substance use disorder that say they've used methamphetamine and fentanyl in the same day. So that cheap available methamphetamine is a newer problem. You may remember, and I think I've been on your show in years past when we had tremendous amount of meth labs in Kentucky, and we were fighting that. Now meth labs are virtually non-existent because you can't make it as cheap as you can buy it.
That said, will we ever win the war on drugs?
Well, we're going to keep trying. People have been using substances to alter their mood for thousands of years. That's not going to change. How lethal these drugs are has changed. And with the prescription opioid epidemic, and this is really where all this began, we created a lot of people with a substance use disorder by accident. We know more about prescribing opioids now than we did then, and we're doing a much better job of managing that than we were then. But every life lost to substance use disorder is worth saving, and we're going to continue to fight to do that.
Van Ingram is the Executive Director of the Office of Drug Control Policy in the state of Kentucky. I'm Barbara Deeb. You're watching Coffee Near Me. I am coming to you via Zoom, as is Van Ingram. Van, keep up the good work and thank you for your time.
Thank you, Barbara.